We will go ahead and start our work session. And I will turn it over to the city manager, Mr. Sanders.
Good morning, Mayor and council members. Again, thanks for coming in this morning. We have 3 topics to cover, and I think we'll jump right into it, with the first being Mobile Crisis and Care Program update from Lorna Garcia.
My name is Lorna Garcia. I have the privilege of working with our mental health crisis response. I work with our care program and our mobile crisis response team. I want to introduce the team leader for our care and mobile crisis, Jennifer Sundquist here. We've got Major McTaggart here, who oversees our unit as well. And I want to especially thank Peter Zemansky. He helped bring this presentation together. So I want to start off. There we go. Okay. So, I'm sorry.
Otherwise, you're not getting on the mic and they can't hear you.
I apologize. Okay. That's better. Okay. So we understand that not every mental health crisis needs this uniform, right? And sometimes this can be very unsettling when we arrive at a person's house because people identify this with I'm in trouble or I'm going to jail. So we've learned that if we can provide alternate responses, that can bring a lot more success and get people to where they need to be. We created a mission statement, more than a year ago, and so wanted to share that. It's to respond and serve all people in our community that are experiencing a crisis, advocating with compassion, empathy, and understanding. And we do that very well. So I want to talk about our mobile crisis response team. This is the original model that we've been utilizing since 2001. It's countywide, and so, but they do spend 90% of their time here in Des Moines just because the call volume is so great here in our city. So that model is a co-response model. Mobile crisis does not go without a police officer, so they're going to those calls where telecommunicator can't determine if there is a safety issue, it's unknown, or if we have identified a safety issue, we're going to make sure that those staff are safe, and so we are there for their safety and we respond together. They're all Broadlands employees. That is our partner, and they help staff those teams. And then once we establish safety, we're able to walk away from the scene, and they can take it over from there, and they can even transport, which has been a really big time saver for us. Mobile crisis is definitely still the highest utilized team in comparison to care, and that's probably because they are available 24/7, unlike care services, and just due to those safety issues or unknown safety issues we can't determine. So I wanted to personalize this and show you who are these people going out there in our community. So Peter took some pictures of our staff, and so we have 2 people assigned for our 3 shifts that meets that 24/7 requirement by the state. We've got a wide variety of staff. We've got social workers, nurses, all different backgrounds. We've got somebody that worked in a group home. We've got staff that has worked with adolescents and teens in particular. It's a really nice variety of staff, and they're really great. Wanted to kind of have them provide some stories of things they've done because they really think outside of the box. They're a very creative team, and they have the time to really dig in and help people with problems that officers don't have really time for at times. So Danny writes, I was responding to a man with suicidal ideation one night. He was grieving but against going to the hospital. We worked through an extensive safety plan together and coping skills. 90 minutes later, he called me saying he needed more help and was ready to go to the hospital. I returned and transported him and assisted him through the process. I think that example really speaks to the rapport she built with that person. She had that trust that he was able to call back and say, hey, I do need a higher level of care. Carol, quote, I received a call from an elderly woman asking to be admitted to the hospital for extreme anxiety and panic attacks. I was able to talk her through coping exercises, decrease her anxiety, and get her crisis stabilization services to start the next day. She was grateful to get immediate help without having to go to the emergency department. And again, one of many examples where we're not taking a person to the emergency room, which is obviously saving a lot of money and not wasting people's time. They're going to get the right kind of care that they need. And if they can stay at home, it's even better. So I want to move on to our city-specific program, our crisis advocacy response effort. As a reminder, this started in July of 2022, so we are a little over 2 years in. The second year has brought a lot of growth and a lot more stability, I would say. So as a reminder, we use some of that local option sales tax to fund this particular program. It's also staffed by Broadlawn's employees. We all share the same office in the basement of the Des Moines Police Station. And we've got that continuity. So our staff on the care team and the mobile crisis team, we can share the same information, and they are cross-trained the same as well. The difference with care is they're not going with law enforcement. So our telecommunicators are doing a really good job of figuring out, does an officer need to go? Is there a safety issue? Perhaps this person is called all the time. We're really familiar with them. We know there's never been a problem. We're going to send the care team out to them. So our hours right now are 7 days a week, basically daytime in the field response. And in telecommunications, we've got somebody Monday through Friday during the day. They play many roles. They do a lot of our welfare checks. They triage calls in our telecommunications center to determine the right level of response. They can provide short-term crisis counseling, lots of referrals to resources because they are very resource rich, and safety planning as explained in that example by Danny. So as I mentioned earlier, they do a lot of welfare checks. We get a ton of those every day. And most of those, you don't need a uniform to go knock on a door. And a lot of those actually can have a psychiatric component to them or a medical component. And so we have really good staff to respond to those calls. Obviously, they go to mental health calls. Rob in our telecommunications center does a lot of our follow-up calls. And that is helping us to try to keep people out of crisis. We know that when somebody's in crisis, their head's full of different thoughts, they're overwhelmed. So steps B and C and D, they can't quite remember sometimes. So it's nice to get that follow-up carrying contact afterwards to say, hey, how's it going? Do you remember what you need to do now? And keep them on the right track so we're not having to have an emergency situation again. They also go to like child-parent disputes. A lot of those things can be mediated just with our staff here, but they also provide that transportation. That's been a huge asset. We haven't had that option consistently throughout mobile crisis. All of their cars have those cab barriers. They have police computers, they have radios, and they're able to go right into the ambulance bay just like officers and ambulances do. So they're going to provide that level of privacy that we want people to have when they're having the worst day of their life. But also, like I said, they do a lot of creative things. Medication pickup for that person that's just their barrier, they can't get what they need. Well, let's get them their medications so they can stay out of the ER. If they need to go get their injection, we can take them to the injection clinic. They've also been able to get people hooked up with food. They've met with people and looked at their fridge, they have nothing, and getting people connected to those basic needs, because we know if they don't have their basic needs, mentally they're going to decline as well.
Or not, excuse me.
Yes.
Here, if they went to a pharmacy to pick up a prescription, how does that work in terms of the sign off, or does the individual
They would have to do some call ahead to get things set up on that end.
Okay.
Yeah. It's not really a huge issue because, I mean, I could pick up prescriptions for my kids or something. It doesn't matter who it is as long as they can verify the information and we know who we're picking up for.
Okay, thank you.
Yeah. Here's a look at our care team. In our care team, we do have 2 pediatric specialists, Riley in the top left, Lori on the the bottom left. Lori is a nurse. She has worked in the inpatient unit at Lutheran in the past. And Riley has a special education PhD. She's really good at those kiddos, and that is her specialty. So we try to get her to those school responses whenever we can. But we have a nice variety of staff. The rest have a social work background. Rob worked for years in homeless outreach. Alex has background in working with service members, and Sabrina with domestic violence victims. So we do really have a great variety in our staffing.
Do you have any numbers, like what percentage of the calls involve youth?
Involve what?
Youth.
Youth?
Yes.
Yes, I do. I can get to that here. Yeah.
Oh, okay.
I do have those stats. Just to share some care success stories. Sabrina was quoted, "I was called out to a gas station where a 10-year-old nonverbal child with autism was lost. We struggled to communicate with him before finding a way to communicate using drawings to eventually help him find his home and return to his family safely." I think that speaks to not having the uniform too, less intimidating. You know, I don't even know if they were necessarily called out to that place, but they went there to help, and it helped. Rob writes, "Through my communication with people, I let them know they matter, and our team is here to assist during their low times. I feel success through making impactful connections, like a callback where I was able to help a struggling young adult find support groups for LGBTQ youth." And Rob is our person in our telecommunications center, and he is really great and diligent about following up with people. So what has happened in the last year or so? We have finally got to a full staffing level. Actually, this month marks, we finally became 24/7 fully staffed. So that's a huge marker, and we've retained all of our staffing, which is also huge because we had quite a bit of turnover. This is a really unique job. It has a lot of challenges, and people that are in the mental health field, their eyes are open when they come into this work because they're going into an uncontrolled environment. It's not a clinical environment. So many variables, so many dynamics that change. And so we're really fortunate we have people that like this challenge and like this kind of work. We also have that new salutation. Do you need police, fire, or mental health services? That's a really nice thing to show, hey, what do we have for mental health services? It puts that in a person's mind. Also lets them self-identify. This is what I need to help the telecommunicator make sure that we get those mental health professionals to that call as well. A huge asset has also been getting supervisors in our telecommunications center that have that telecommunicator background. They have really vastly improved our data tracking and utilizing our teams because we collaborate with them and we're just making sure that they're getting the right person to the right call, and that has really helped our statistics. Also, they have been given suicide intervention training, some ongoing training, just to keep those things in their mind. I know recently, actually, a group of them went to some de-escalation training too. So all these things are really helpful to making these programs successful because they're the person that determines if we go out or not. So they're the key to it all. So looking at some numbers, this is between both the CARE and our mobile crisis response team. From July to July in the fiscal year, we had 6,384 calls both teams went to. And amongst all those calls where those staff were there, only 68 arrests were made. I think that speaks very highly not only to the staff and our teams, but also the police officers. They're doing a really good job of determining what is the primary concern here. Is this a mental health issue? And this is why they're loitering or trespassing, and they're taking care of that person's needs and using their discretion appropriately. Out of all those people, they only transported over 1,000 people to a higher level of care, meaning a walk-in clinic or the ER. And so that means that over 5,000 people were able to stay in their home. That's a lot of money saved. And I know, looking back at my early days on patrol, numbers were flip-flopped because we didn't have the resources of having these teams to help guide us, and we're a lot more knowledgeable now. So if we're focusing on just our CARE team, in the fiscal year, there were 1,073 field responses, and of those, 744 without a police officer. The difference between those numbers is because CARE does back up for mobile crisis. They're trained the same way, so when mobile crisis isn't available, if CARE is available, they're going to send CARE with the officer to a call. And so that's what that statistic is. 1,342 calls were handled in our telecommunications center. So some of those are triaging calls, short-term crisis counseling, but also those follow-up calls that I spoke about. And then for a total number of calls, 2,415.
When you say they'll send someone from care with an officer, that's just someone who's on patrol then? Or,
Yes, yeah, most likely just patrol, if it's not the mobile crisis liaison officer. Yes.
okay. So these were identified calls that warranted an officer, but that,
Right. They had a safety concern or we couldn't determine safety, so we had to default to mobile crisis response, but they weren't available. So we're going to utilize the staff that's available, which would be care. If they were in service, we'll use them. So looking ahead, we want to continue delivering compassionate service. We want to grow the program to increase availability in our scope of services. Interestingly enough, our statistics are showing us that overnights we probably don't need any more staff. And weekends we don't need more staff. That's where our numbers are lower, which is really interesting. You would think the weekends would be busy. They're not. It's more just during that Monday through Friday stretch, days and afternoon evenings. We need to keep promoting our successes. We want to keep raising awareness. I think our numbers continue to climb because people are becoming more aware, or they've utilized us once, so they'll call back because they know what kind of service that they can get with us, and getting more comfortable with that. Trying to foster those positive relationships. Our teams have done some proactive outreach. They've stopped by, talked to businesses, told them who they are. So if they see people of concern, hey, when you call 911, you can get something besides a uniform, kind of put people at ease. And we're also collaborating with our mobile integrated healthcare program. They come to our monthly meetings because we're serving a lot of the same clients that they are and trying to problem solve with them. That's been really beneficial as well. That is it. You asked about the, I guess you asked about the child calls. Yes. So I have the statistics for 2024 from January this year up until September, so just closing out the month. We have seen 474. Our numbers usually range 50 to 60 per month is probably an average. However, in the summertime, it's always dips down into the 30s, and that is standard. Our calls just decrease. When you don't put kids in a restricted environment like school, they tend to do better, and they're not in crisis as much. Just kind of how it goes.
do we know how many calls that we would send someone from mobile crisis or cares that we are unable to do so because of staffing?
So I've got a little bit of statistics on that. Actually, I believe last month we had, I think, the highest numbers of missed calls I'd seen for a while. So in September, we had 104 missed calls for mobile crisis that meet that mobile crisis criteria. And this is the data entered by our telecommunicators, by the way. The care and field response, they missed 119 calls. And then calls in our telecommunications center, 50 calls were missed. It gives you an idea of just in a month.
And those would just be responded to by patrol?
Yes. Yep.
Okay.
So missed by care, but still responded to.
Yes.
Gotcha.
Absolutely. We're always going to respond. Officers are always going to respond to every call that comes in.
What kind of data do we track in terms of, we have the mobile crisis, which is officer paired with mobile crisis. And I know we've been deliberately cautious wanting to prioritize the safety piece, so we send an officer.
Mm-hmm.
Are we learning from the more calls we go on if there is some opportunity for more calls to be responded to just with care or a...
The criteria will never change for safety, I will say. And I would say, I know Jennifer has talked, I mean, they depend on us for safety. I don't think we've changed our criteria. What I think is changing, though, is the comfort level of telecommunicators. I know there was a great resistance. They're so safety-oriented, as they need to be, that they were reluctant to send to mental health professionals out into the unknown. And I think our numbers have gone up, and a part of that is because they've seen that most of our calls, there's been no safety issue. We have had a few calls where we have had some safety issues with care has been responded, but they are very minimal. But it is kind of a reminder that, triaging calls is very important.
That's interesting. Have we tracked, do we know how many calls where care responded that they needed to call an officer for?
Yes. Jennifer keeps this really detailed data on the broadband side. So in 2024 so far, so January through September, care turns into a mobile crisis call 21 times.
21 times. And that was out of how many care calls total?
That would be 745 for the year.
Yeah.
I will speak, though, to our staff on care. They have been trained, and I trust them very much to trust their instincts. If they go to something and something doesn't feel right, they have that radio. That's why we have them set up for success, to get us to come and help them out immediately. And so we've been really fortunate that nobody's been seriously hurt or anything like that.
I think Scott.
Lauren, could you add that the interactions themselves, oftentimes the police officers in the background, is that
Yes.
correct?
Let me tell you the relief that officers feel when they see care or mobile crisis on scene, especially when you're dealing with erratic, unusual behaviors. They're intimidating. They can be when you're not at a comfort level with those kinds of things. And they are. So they oftentimes like to have them take the lead. They're just standing in the background to make sure nothing else is going to happen. And then it's up to the mobile crisis or care staff to say, hey, I'm good to go. We use their discretion, their comfort level to walk away.
Did anyone have questions over?
Will this be online? The handout just has 2 pages. Can we
The
get
complete.
Yeah, it's just,
Yes, we'll make sure we.
Okay, those were just some numbers I'd like to share
Yeah.
with neighborhood associations.
Yes, please do.
Mayor, I
Mr.
have a
Simonson?
couple of options. First of all, I think the residents of Des Moines who supported the local option sales tax should be very happy that this is how money is being spent. Second observation, sometimes throughout the day I identify my heroes. You and Jennifer are my heroes for the day. I would encourage you to think big. I would like to think of this as just the beginning of an effort to help people who are really in need, and I thank you. Thank you, Jennifer.
Anyone else have any? I was just, I had the question because I've always asked how many officers I always say they all need to be trained like you, Lorna, but how many are working with you and you still have just one officer assigned?
I do have one officer, but I now have the new homeless outreach liaison officer that will be working with me as well. So
Okay.
they're going to be serving a lot of the same people we see. So there's going to be a lot of collaboration there as well.
So the main tie through, even talking with the fire department too, was the mobile integrated is mental health. They said almost everything they're dealing with is mental health, the high majority. So throughout our community, what is your assessment of our opportunity to help people with that?
I think we're offering a lot of, I'm excited about mobile integrated healthcare.
Right.
We are I call them on their cell phone. They call us. We're on the same team is how I look at it because we are serving the same people. I can't think of any more robust program in the state. We have the best. We are doing the most. We are the most assertive in getting people what they need, and I'm really proud of the work they do every day.
So on behalf of this complete council and the community, thank you for the work you've done in leading the way with coming up with new solutions to help people in crisis. So we appreciate all the help you.
It's my privilege. Thank you.
Okay. If there's no other questions, we will move on to the next item.
So as we get prepared for the second topic here of the morning with the land trust, I want to thank our community members that have been involved quite a bit with the creation of this new program. And I want council to pay attention to the details here because this is the future of how we're going to be providing affordable housing to our residents in a lot of different ways in partnering with our community. It's a different approach. We're very familiar with subsidizing and putting public funds into housing to assist homeowners in their struggles and desires to have their own homes. But this is treating the homes as assets, if you will, that then can remain affordable one family to the next. And you are lifting up the individual families, but you're sharing in the appreciation, if you will. And so this is a long-term solution. I wish we had implemented this 20 years ago, but today is just the second best opportunity to get it implemented. And so with that, I'll pass it on to Chris. Thank you.
Thank you, Scott. Mayor, members of the City Council, Chris Johansson, Neighborhood Services Director. As Scott said, first big thanks to Amos, the advisory committee, and the council for your support so far through this. My role is just give a first little history, kind of where we've been a little bit today. I think many of you would remember it was back in 2022. Amos hosted a ground solutions workshop. There was about 50 local leaders that attended the meeting just to first learn a little bit about what a community land trust is. From there, the city started discussions with Amos, just kind of talking about the next steps. What would it take to help create this? The city, with help of the Polk County Housing Trust Fund, did receive funding from them to help hire a consultant and to kind of help frame what that framework's going to be going forward. Over recent months, West Des Moines, Polk County, and Waukee started sending staff to support the advisory committee as well. So it's getting a little bit of more of a regional approach to this as well. And the advisory committee has begun their work. They're kind of midway through this, and this is kind of a good point for a check-in with the City Council just on what some of their recommendations have been so far. With that, I'll turn it over to Tess Cody. She'll kind of give you a good summary where we're at today.
And I think joining us on the phone is Brenda Torpy. She is the technical assistance person that we've been working with from the Champlain Housing Trust. So Brenda, if you want to maybe kick it off with just a brief introduction of yourself and what we've been working through.
Good morning, Tess, and good morning, council members. I'm Brenda Torpy. I'm a former CEO of Champlain Housing Trust. This is now the largest trust in the country, and we started back in the 80s, so of course we should have built something up by now. I left that post in 2020 and launched our technical assistance arm, TACHT. And I've worked with, I was counting up about 25 groups since then, but only about 15 of them as a length of time and in the mode that I'm working with your city. I want to say that it's been just a pleasure and an honor to work with your team and the teams from Polk County and West Des Moines and the advisory committee. You have you're proceeding in building all the conditions for success that I would recommend for a trust: your citizen involvement, your city support, finding a nonprofit steward, being non-competitive but adding value, the shared equity home ownership that doesn't exist yet. So congrats so far, and I'm going to leave it at that, and I'm on the line if there's questions after.
All right, so my job is to give you the speed refresh on what's a community land trust, and then in a moment you're going to get to meet two of our advisory committee members who are going to share the recommendations they've made so far, and then Chris is going to wrap us up with our next steps. So some jargon that's out there. Community land trust is what we're talking about today, and it's about stewarding land in perpetuity for the preservation of affordable housing. That's the genre we're looking at. There's other terms that we toss out about, like land bank, you'll hear, That's really thinking about troubled properties that need help clearing their title. They'll come into a land bank short term, move on out into good use. But our legislature is also using land redevelopment trust, which sounds all really similar. Land redevelopment trust here in Iowa, that's actually land banking. So to kind of merge those two together. So Community Land Trust is a nonprofit, and they use community control through a tripartite style of governance. So think residents of the trust in with some community members in the service area with public officials on the board. They steward homes into perpetual affordability. So think the really, really long term. It's good for the first homeowner, the second one, and the 10th one. And they use a model called shared appreciation, sometimes shared equity, that they use. You'll hear us talking a little bit about a ground lease, which is really just the kind of contract that ties it all together and sets the terms of how, as the home grows in values, how it's going to be split to keep that affordability. And they often have a lot of stewardship programs to help set people up for success. There's a lot of types of land trusts out there that have a bunch of different things in their portfolios. They can do rentals and condos and co-ops and a whole bunch of different things. If you really want to dream big, man, you just start looking at what some land trusts around the country are doing. The thing that they bring to kind of the universe that is unique and special is preserving affordability and home ownership. That's what they do really, really well. And so that's what we were tasked with starting with is if we set the groundwork for affordable home ownership, then, 10, 20 years down the road, if you want to diversify a portfolio, you could. You've laid all the groundwork you need to. So I really like this graphic. It helps me conceptualize how a community land trust works. The idea is the community land trust will always own the land underneath the structure. The home gets sold to a homeowner, and they're tied together by that thing I mentioned called a ground lease. It's a little different than a commercial ground lease because the kind of core to it is this thing called a resale formula. That's one of the things that our advisory committee is going to share a recommendation about, is how that resale formula works. But it really just sets the terms, how you split, who gets what when the home is resold. The homeowner uses a traditional mortgage to go and buy their home. I think one thing I always like to just highlight here is just that when we talk about affordable home ownership in our market, just having the land stay with the land trust is probably not enough to bring the home into affordability. So there's sometimes some initial front end layering that kind of sets that affordability. I think that's helpful to keep in mind when you hear things like that resale formula, that it's not just a split of the home value and the land value. There's some other ties in there to make sure that long term it's still good for the next home buyer. We get a couple frequently asked questions. The very first one seems like an important one is, does a community land trust make sense here? And I think the more we dig into it, the more we say yes. There's been a bunch of past studies, again, highlighting that workforce housing strategy had a thing about a specific income band really being primed for if they had a bit of stretch assistance, they could get into home ownership. They've got income, they could maintain ownership, but needing a leg up into home ownership. We recently have been, at least in our department, in really deep on the fair housing study and the survey that is, you'll hear about more next month, but affordable housing came through really loudly and clearly. And then I think the final thing that really tips us towards yes, it makes sense, is hearing from our nonprofit partners that they have more people interested and qualified who would be great homeowners coming to Homing Habitat than they can serve. And so how can we help be a catalyst for affordable home ownership? I think a community land trust can be a big part of that. And last but not least, I think it's kind of what Scott alluded to. It's a great opportunity to help public dollars go even further. Another frequently asked question we get has to do with property taxes and property values. The first one is, do they negatively, maybe inserting that word, do a home that is restricted on the price you can resell it for negatively impact the neighbors? And the answer is generally no. First and foremost, a home that is resold through a community land trust is not an arm's length transaction, and so it shouldn't really be used for appraisals. And also the way that you document the sale price, it's kind of like if somebody was helping you, you're really writing down the cost of the mortgage. And so the sale price, you can document the way that I'm really excited about the version that they're going to share, an appraisal-based system where you can document the sale price, but then you also have this assistance that brings that mortgage into affordability. And then the property taxes, the homeowner generally across the country still pays the property taxes. They have exclusive use to the property. And then the next question we get is, how is this beneficial for homeowners? And I think really centering, when you think about this, of who the Community Land Trust is aiming to serve, for most community land trusts, it'd be folks who would, but for the opportunity through the land trust, would stay renters. And so there's some really great research comparing the impacts of community land trusts and setting it against traditional homeowners and setting it against rentals. This is a 2022 survey that we kind of took a snapshot from, but my takeaway is they listed out kind of these ways that community land trust owners found success and how they're measuring their impact. My big takeaway is community land trusts really see like the whole picture, not just getting people into homes, but setting them up for success in the long term. So you see things like fewer residential moves, greater sense of their house being a home. Those are really great things. That's the stewardship of community land trusts. But we also have, of course, the thing everyone loves to talk about, which is CLTs are a step into home ownership, right? It's that climbing the ladder, but it's also a way to build wealth. And so included in here, kind of a side-by-side comparison from another model of setting aside a rental, a CLT ownership scenario, and a traditional market ownership. And I think just as you kind of work through those numbers, and you kind of look at the monthly housing costs, of course, in a traditional market would be a bigger reach for a household. But then when you compare what they walk away with at the end, and if you can just help people get into the home, man, they can walk away with funds that they can use to go put a down payment on, they're moving out of a starter home into a next home, right? Or whatever it is that makes sense for that family, that they would not have necessarily had access to that wealth potential and wealth development had they been in a rental. So with that speed version, I'm excited to welcome up here two members of our advisory committee, Cheryl and Jessica. Bring it on up.
Hello, great morning. My name is Jessica Avant, and I am on the Des Moines CLT Advisory Committee. I have been a resident for 20 years and an advocate just as long. So I just at first want to say thank you for helping to put in place the advisory committee and for all the support the Des Moines City Council has shown us. The purpose of the advisory committee is to really discuss the big picture items of putting together the community land trust. So over the past few months, we have been thoughtfully studying and analyzing different CLT models, identifying risks and opportunities in general and in Des Moines, and putting together a framework for the actual governing board to go by when they are established, which after that they'll go into more of the nitty-gritty details of how they would like to operate. But this is just a jumping off point for them so they can get into running on the ground.
Hello, I'm Cheryl Ferracci. I've been a resident here for quite a while. And thank you for getting us to this point. We appreciate it. So I want to talk about the population to serve. Our aim in this is to help working people who do not have access to the. Oh, thank you. Working people who do not have access to the housing market. So what we are using is the HUD's definition of the area mean income to define our target market. So we also want to create that 30% housing expenses affordability, which I think you probably all are familiar with. And as our target, we're looking at 80% and below as our target AMI for these homes. And we are looking at our 100% for our upper limit because of flexibility. As you know, the market recently has started to change, but before that it was pretty intense, and people who were at 100% AMI were still not able to get into a home because of the really the interest rate and the raise in the price of housing. And then I want to go on to...
Actually, pause and
Okay, sorry.
So one of the recommendations that we needed to, well, one of the questions we needed to answer was, well, who are we going to serve and where are we going to serve? And there were pros and cons to both staying in Des Moines as well as opening up to the surrounding areas and even other counties. But we decided to focus on all of Des Moines, all of West Des Moines, all of Polk County, but still stay firmly committed to working with other cities and other counties and things like that if the opportunity arises at a later time. And the reason for that was because if you look at the studies, Des Moines, Ankeny, Urbandale, and West Des Moines collectively have 150,000 plus asset limited, income constrained, employed households. And so we felt it would be best to focus on those areas, meet the need where it's at, as well as it's important to give housing choices to make the best impact. And also opening it up to, as well as Des Moines, West Des Moines, and Polk County are already at the table, so we already have a somewhat working relationship with them, as well as being able to have greater access to partnerships, resources, in addition to those housing choices.
So I want to talk about the resale formula. So our goal is to preserve the affordability in perpetuity and to help folks create generational wealth. So this is what it does. It defines the ground lease, the relationship between the homeowner and the community land trust. And it also preserves the long-term affordability of each house. So we chose an appraisal-based formula. There were lots to look at, and some of them I didn't even understand. Not that I should understand them all, but I didn't understand them. And the reasons are two. One, because it's simple, and the other one is because it encourages the homeowner to grow the value of their home. So this is how it works. There are two appraisals. One is just before they buy the house. These are market rate. And the second one is after they sell the house. And then the appreciation is the difference between the two. We assume it's always going up. And then they split it, giving 25% to the homeowner, and then 75% stays with the community land trust. Do I do the next one also? Is that next? Oh, governance, gotcha.
So another recommendation that we had was for governance. There are a variety of different models that CLTs go by, but one of the things, oh no, I'm jumping ahead, operations. Who is going to run the CLT? And we still have more questions to go in relation to that, but we did do some work. City Council, city staff and advisory committee members did explore with different local nonprofits that deal with housing affordability if they had an interest in starting a CLT themselves, and there was none, so that would fall on us. And then the second question was, well, who can help us operate the CLT, at least to get it standing up until we have our own operations infrastructure? So One of the recommendations that we had is that Home Inc. is the nonprofit expressing a willingness to evaluate what it would take for them to contract to operate and help stand up the Community Land Trust. So we are recommending to the board that we move forward with trying to make proposals and negotiations with Home Inc. specifically. Second, we looked at if we should use an organizational structure that includes membership. For us, membership is an important component of oversight and accountability, not just for the board, but also for the people that live in the community where the Community Land Trust will be operating. As Cheryl so eloquently put it, the membership is the community in the Community Land Trust. And so we want residents and leaseholders to feel like they have a voice, not that they're just being impacted by a program that they're a part of. So there are typically a variety of powers a membership can have, but we chose to have a balanced approach since membership would only meet once every year during an annual meeting, and that would give the flexibility of the board to make quicker decisions for some of the more intricate housing stuff.
So Home Inc. will be the board that operates. Home Inc. will be the board that.
Great question. No. So the idea would be like contracting with them for services. So think of them more as, and all to be still determined, but no, it wouldn't necessarily be meaning transforming the Home Inc. board into the Land Trust board. The thought would be a separate 501c3 with a board that then contracts for services from Home Inc. to stand it up and operate it. Yep.
Okay. Thank you for clarifying that.
Okay, the scale of impact. It helps to dream big, right? So we want the CLT to survive and prosper. And so we want the advisory committee is encouraging the board of directors to set some ambitious goals. So we want you to know what we think they should do in this regard. Because it will help define what kind of monetary needs they have to create this.
Just to kind of wrap up that thought, they were discussing at the last advisory committee meeting that scale question, not locked into those as goals at all. It's really about fostering conversation. So when you see these numbers up here that I have now quickly skipped ahead of, I think really just get yourself thinking about how can we here in Des Moines be part of it? How can others be part of it as well? And I think, Chris, you're closing it up.
So when we look at those numbers, are those new homes constructed or those can be homes purchased? Doesn't matter?
Doesn't matter. They're actually, CLTs get populated in a lot of different ways, and some younger CLTs, what they'll actually do is they'll be partnering with developers who are actually constructing them. They're not a developer themselves. Some are actually running programs where they are kind of layering in the necessary assistance for a home buyer to go. They'll buy a home off the market, but the land will at the same time come into the land trust and they'll kind of provide that assistance. So it can be through construction and development of new homes, but it can also not be. So it could be a whole wide variety. And I'll put my plug in. I think one of the most exciting things for me is I think there's some different ways that cities can help populate trusts. I know Brenda shared some examples with us about leveraging TIF deals on townhomes to have townhomes come into trusts. That would have potentially been a 10-year rental or something like that. So really thinking differently about how things could come into the trust, I think will serve us well in the years ahead.
So do we have any of the region, or is it just Des Moines that we're doing this? Is any other community going to
Yeah.
partner with us to,
Well, I think
other than West Des Moines maybe, or?
great. These are great questions. So, in the last 8 months or so, Polk County and West Des Moines and Waukee have started sending some of their staff to listen in to the advisory committee meetings. Of course, we've made no actual like straightforward asks, but I think that's where some championship to help bring them to the table will be critical.
Okay, good to know. Thank you.
Sorry.
So, from the workshops that were in 2022, right, at Grace Methodist.
Yep.
So there were some models that were like a subdivision that were all community land trusts homes, and then others that were sprinkled throughout the community. Have you chosen a path? Which direction seems to make more sense?
Yeah, when we were looking at the service area, they were really thinking service area wide, so I think much more of that scattered site. I think the nice thing about that large service area is if opportunity presented and it felt appropriate, right, as the future board does strategic planning, you could be intentional about work in specific areas looking differently. I think Brenda, with her work in Champlain Housing Trust, they've identified that just their approach and land acquisition in different parts of any given metro for them and their metro has to look different. But we've taken that scattered site approach versus, okay, we're just going to work in a specific neighborhood.
Okay, so there are other nonprofits in the area. I see Habitats in the room. Invest DSM has properties. So like, I think in the Columbus Park neighborhood, there are 10 or 12 vacant lots that just waiting for something to happen. So could the community land trust acquire those vacant lots? If now, I'm not sure where the money to acquire the vacant lots from Invest DSM, and then someone builds on it.
Yeah. That sort of thing is exactly what could happen, and I think it'll be through partnership with a bunch of the other nonprofits. I mean, Habitat and Home Inc. have been part of our advisory committee, and I think that they've brought just really great insight because of that lens of collaboration. But I think that's exactly right? You could have a scenario where land trust acquires land, works to have a developer develop it, and brings it into the trust that way.
So, okay. So then the money to acquire the land, where does that come from?
I think it comes from a lot of different sources. I think that land trusts have to kind of build their budget like any nonprofit. I would assume, and I think Chris will talk about this, but I think the hope is that we'll be part of the table of that early on. Most land trusts rely kind of heavily early on in government assistance, but a lot of them will leverage fundraised dollars, foundation dollars, even IFA, federal other dollars. They'll kind of layer into their portfolio.
Just to kind of wrap it up here, just looking at the next steps, kind of what's been talked about. The next 2 months is really looking at the governance structure and what that's going to look like, and also recruitment to get that final board in place. Then after that, starting into 2025 is that transition from the advisory committee to that founding board, and hopefully still working with Home Inc. to be that operator to kind of help operate this moving forward. Then additionally, next steps, staff support. We've had Tess Cody, as you've heard from today. I anticipate she's going to be working with this group just to get this up and running. And then after I know Home Inc. comes on board, kind of look at what her role will be kind of moving forward. Funding to support. I know we've kind of jumped to that pretty quick. The operating, it is pretty obvious. I think after this gets up and running, there is going to be requests coming to the city, and I would imagine any other governmental entity looking to participate in this to have some sort of operating funding going in to help sustain this. On the development side, I think one thing for the city, especially I know specifically for neighborhood services, a lot of our affordable housing dollars that we use, whether it's our federal funding that comes through, looking at ways to tie this to the CLT, that's a question, a policy decision. It's going to have to be made, but that's something we're going to be looking at as we move forward with this too. That kind of gets us right into the project alignment. I think when we start talking about a lot of these affordable housing projects, what makes sense for the CLT and how we could partner moving forward with a lot of those, not just in our federal funding, but other funding that the city has where there are requirements for affordable housing as well. All right, any questions?
I have a couple of thoughts. This is a monumental effort, to be sure. Is Brenda Torpy still on the phone with us?
You bet.
Thank you. She's done it before. She knows what other communities are doing, so I'm sure you're relying quite heavily on her. Couple thoughts come to mind. Local lenders are going to be critically important, and for them to understand how this works, they might also be a funding source, just as an effort for the local banks to get involved in the community. A couple names come to my mind if you want to see me afterwards who could be very helpful to you. Are there any legislative issues? I'm just throwing that out there. I don't know of any, but that's always a big picture. And funding is going to be huge. I love this concept. I'm glad that it's scattered throughout. When you live in a neighborhood, nobody knows how you purchased your home, and that's the way it should be. You're just part of the community. Brenda, describe how you'll remain involved, or your understanding of how you'll be involved.
Yes, thank you. And I appreciated your comments spot on. I think there are a lot of banks contributing at the national level, and local banks not just participate for mortgages, but making contributions, as you noted. They can be just terrific, important partners. My contract right now goes through next spring, so working with the team to get the board seated, and then the board will need to further define some of the approaches that the advisory committee's recommended and specify them. We'll form bylaws, what's bylaw, what's policy, and so on. And then assist with the onboarding of their contract with Home Inc. That all works out for administration of the program and getting those first, projects in hand so that you do have some pipeline to get started. So I think that's how I imagine it. I know Tess probably has even more insight from the city side, but that's how we're working together.
Thank you.
That's annoying. I do have one question, and either for the team that's here or for our expert. I can picture a lot of good in my ward, and just picturing neighborhoods around the city, like many of mine, that existing housing stock could be a really good way to scale this up, build it. And I think it also provides a great benefit for the existing neighbors who might be living by a property that might already be questionable, that could go from low, when these houses are for sale, most of the houses that are selling for $200,000 or less in my ward are going from owner-occupied to rental units. So, I see that as a real justification for government dollars. What's been your experience for successful community land trusts that have focused more on existing housing stock?
Tess, did you want me to give a couple, or?
Yeah, Brenda, if you have any quick takeaways for Chris, that'd be great.
Yeah. Okay, sure. So our trust here in Vermont, the Community Land Trust, we started with that. We called it buyer initiated. We would help people with, qualified people for the mortgage and grant, and they could find a home. It would have to go through our quality standards. In other cases, acquiring homes that have been in foreclosure and fixing them up, making them very energy efficient. And you're so right that when you do one home on a block that has been blighted, you're helping the whole block, right, to vitalize, bringing value back, bringing that sense of we're a neighborhood back instead of having vacant buildings. And then there's a tremendous programming that's been piloted in Minneapolis, which is now spreading across the country, where folks who've been in their homes maybe a long time, but are house rich and income poor now, either because they're on Social Security or whatever and can't pay taxes, can't maintain, are offered the option of exploring this program and then staying in their home and having it improved. But in return, at sale or in their estate, it would come into the program. So they're getting that upfront investment and then it's paid back at resale. So I can tell you that one thing that land trusts, like other creative nonprofits and municipalities trying to crack the housing problem, are using every possible means and approach. So you could, anything that comes up that's available, that's possible, is something we'll be able to explore with your team there and your nonprofits and see if it'll work.
The other question I have is that I read your materials on the website at
Grounded Solutions.
Yeah, Grounded.
Grounded Solutions. Yes. Yep. A national network. Mm-hmm.
And there is, I just have a question about targeted geography.
Mm-hmm.
I know we're working maybe with West Des Moines and others. How tight would you design a targeted area?
These are very local and sort of local market and local public policy decisions. But I'll give you some examples. I think going regional is an excellent approach because it brings in the opportunity. It's a housing market, right? The region. You see that as unified. And as a previous commentator said, when you can do homes within neighborhoods, do infill and so on, you're really integrating. That's how we started to integrate the suburbs where there wasn't much affordable housing. That's a great strategy, but I always recommend CLTs and their boards to have acquisition strategies and policies so that, like you want to be transparent, and there may be conditions that would define a target area. For example, our trust has always had a target area, a very low-income neighborhood that have very high infrastructure and housing quality needs as well to preserve it from speculation and to remain, the residential neighborhood. And that can be a really good purpose. It's a targeted purpose. So sometimes what you're doing is pure home ownership. There's always some community benefit, some community development benefit. But some strategies are really, community development. Some CLTs who target neighborhoods, for example, will do assistance to small businesses to stay put, that sort of thing. So, yeah, I think one of the things the board will grapple with, and I think I trust the local government's input, is what is that strategy? We know we want to maybe integrate all these communities where there's affordable homeownership opportunities, but are there other things? And the targets can change over time, right? The priority targets, or at least you might have to move your priority in time, having done some achievement in one place. So, that remains. I think on Grounded Solutions as a targeted strategy for them nationally, because everybody goes through. They're the only national doing this, and they have to be strategic about which communities, and they want to be transparent about that and have a policy. So I guess is that equivalent at the local level. Did that come at your question okay? Or
Yeah. Great. I don't know if it's the phone that's creating the ringing?
Good question.
I don't hear, I
That's not
have
it.
clarity at my end, but
Okay.
Mayor, I have
What-
one concluding comment. I
Okay.
see this as a very valuable tool when we think about Invest DSM, Habitat, all the other organizations. If we're pooling together and working together and targeting neighborhoods, this could just be very important.
It's another
Mhm.
way to get housing and more affordable for people. So only because we're having a little sound technical difficulties. Thank you for your call in today. And I think we will, if there's no other questions, we'll just move on to the next item.
thanks all. Have a good day.
Again, thank you to our community members.
Right.
See what, you want to try a reset on the sound?
Where?
No, I mean this.
Is it the light?
Jason, what is the schedule for the hearing, set hearing? Could this be delayed? Because that is pretty annoying.
Thank you. I do want to thank real quick, the community members.
Yeah.
Thank you for coming down today and being part of it and all the work you've been doing over the few months, or year.
Well, I'll give them a choice.
Thank you.
These amendments will be on the agenda on the 21st, so we were hoping to just hit a few high points today, but I could also follow up with an email with all the details and then answer specific calls if you wanted to handle it that way. the city as a transitional use until it develops. So we need a change to reflect those changes. So we are expanding that use category in the zoning code and then establishing the accessory building type in Chapter 135. Your next slide or page in the handout here, this is a graphic from the current, from the zoning ordinance as it stands today. So this is out of the table of uses, and you can see it's zoomed in or focused on the ag section. In that category, we have community and urban garden, crop production, and nursery or truck farm. And just if it's a closed circle, it's permitted by right in those zoning districts. If it's an open circle, then it's a conditional use and requires zoning board of adjustment approval before it could go in. So you can see that, you know, the currently on the books that community and urban garden is allowed across the city, and there's just more limitations on the crop production and truck farm. Next slide is the proposed changes, and it starts to bring in the language of the additional districts that we're looking at. So first district is aquaculture, aquaponics, aeroponics, and hydroponics. Of course, I'm going to need my readers, so I'm going to read off this paper. I was going to get by without them if I could see it up there, but so this is, you know, largely you know, a use that would happen in a building. So think of it as vertical farming, you have industrial, but not necessarily industrial in scale. But then we have the two categories that are the more traditional, the truck farming, the crop production, and then breaking up the idea of a community and urban garden into two different uses. So urban garden and urban farm. And you can see in this chart that the urban garden would be allowed in all districts across the city, including making it a permitted use and not a conditional use in the flood district. And then urban farm would be allowed very similarly, except for in residential districts would be a conditional use. It's intended to be a little more of an intense use than a garden. So that's why we felt that it made sense to make that a conditional use. Well, I'll get there here in a few turns of the paper. Just trying to give you a sense of like what districts would be allowed in. So just quickly, we didn't do a whole lot with truck farm and crop production. Just really clarified the language that's in there today. So I don't really need to spend a lot of time on that. Certainly I can answer questions if you do have questions on that. So I'm going to skip ahead to aquaculture, hydroponics. So that involves the raising and harvesting of plants in a non-soil environment. May include the harvesting of aquatic organisms, and it must be within a building unless it's in the ag district. So these are kind of the key things coming out of the proposed language that's a part of the draft. I do, in the handout in my presentation, have the actual code language that's being recommended. I'm not going to read it to you verbatim, but it's there for reference. If you see something you want to take a deep dive on, let me know, or happy to talk to you over the next couple weeks as we head towards the actual hearing. Getting to urban garden, hopefully you're on that page. Permitted in all zoning districts, like I said. Limited retail sales. So right now the community and urban garden use doesn't allow sales unless it's permitted in that district or conditional use. So hearing feedback from the community, from the Food Security Task Force report, and looking at other ways other cities are regulating this type of use. I just with the little getting off kilter here with my start, I meant to also let you know within the ag category, we did take a lot of time to research other cities, see how they're doing it, best practices, reviewed information from Iowa Extension, worked very closely with Jeremy Caron on the development of this language, met with the task force to circulate it, get their feedback, prepared a draft, circulated that draft in the community, got Jeremy collected feedback, made changes, and then presented this to the Planning and Zoning Commission and incorporated their changes. And so just with in that context of all the feedback we got, felt that it was important to add a limited amount of sales. So the number that we came up with through that kind of long process was 16 days a year, maximum of 2 days in a row. Wouldn't restrict passive sales. So if somebody has a cart that's got produce on it and, a bucket that says, put your money here, kind of an honor system, that does not account. These are active sales where you'd have somebody there manning a station.
Jason,
Yes.
is this part of what Chris Draper has sent emails to us about incorporating these?
I would assume so. He was, he was on the plan. He's on the Planning and Zoning Commission, and he's been very supportive of this code amendment.
Right. These changes are what he's been promoting the last
Yes.
few months. Okay,
Yeah, I think
gotcha.
he wrote an editorial about it even.
Quite possible.
Yes. And then just flipping the page there, just going on, we, in the urban garden, urban farm, we're proposing to get rid of the fence requirement. There would be kind of a cap on equipment size at that subcompact tractor size. Another thing that we heard through this process is just there's a need to clarify the language in the code about composting, prairie plantings, and seed harvesting, that you're permitted to do that, that's not weeds. So we've included that language in our proposed amendment. So on urban farm, so again, I included the code language. I won't read through it. There are a good number of performance standards or measures in there. A lot of them are based off of what's in the code today. Key takeaways for urban farm is that it's permitted in all zoning districts except for in residential. It's a conditional use, so we're going to notify neighbors. There's going to be a hearing before the Zoning Board of Adjustment. There's no limitation on sales, so that's kind of a step up from urban garden. It can include educational and tour opportunities and programming, so it's going to it draws people to the site a little more frequently. And
what
then
page are you on?
Well, I'm on the
19.
Yeah. This is the down. I like my slides to be very minimal, so I don't put numbers on them, and this is the downside of that, I guess. I mean, I can see the computer, but oh, sure, okay. I didn't realize that this was functional. Okay, I thought everybody with Joe had handouts, so I apologize.
We're still looking at the handout.
Okay.
We're good.
All right.
You just went from urban garden to urban farm. And wait.
Yeah, no problem. Technology's great until it doesn't work. All right, so hopefully you're seeing that urban farm. So again, we're bringing the difference between this and the garden is more people are coming to the site, slightly larger equipment size allowance. Those are the key differences. Again, this is the code language. We can deep dive into it if you want. But I also, we're doing this to give you a couple weeks to noodle on a little bit, ask questions if you want, if we need to make tweaks. In the code. Yeah, excuse me, let me go back. Like this kind of text that you're seeing, those are supplemental regulations that'll be in the zoning code. So those are enforceable standards that you have to just comply with, whether or not you're a conditional use or permitted by right. But there is nothing in the code would have suggest like a cap on numbers of people at a tour.
Urban farm proposal is allowed by right in most places except for there they so that right.
That's
if there was concern for resident farm.
Absolutely. That would be something that the Board of Adjustment could apply as a condition. Or if it's, potential, for some reason, you could, the zoning board of adjustment could potentially even like say, you only get 2 or 3 of these a year because of the nature of the area you're in. It's just a case by case, allows you to nuance.
So, could you have what would a community garden where
Well, like,
it's a space, but not run by Parks and Rec, but
so that's the urban garden category.
so that would be an urban.
If you're not worried about hosting tour, you're not doing programming, and you just it's mostly the what we originally thought of as community gardening. That'd be under the urban garden.
Got it.
It's permitted everywhere.
Got it.
You bet. So the last bit of the proposed changes for the ag category is in Chapter 135, we need to add the ability to have these hoop houses and low tunnels and cold frames as an accessory building type. So proposing to create a seasonal ag building in Chapter 135. Minimum 5-foot setbacks from all property lines. If it's residentially zoned, you need to be 20 feet back from a front property line. Language in the draft about keeping it in good repair. This is the code language. That is so now I move on to data centers. That really
Like one example of something that would need to be an urban farm and not an urban garden.
I think a lot of the Woodland Realm, some of the events they were doing, might kick them up to an urban farm. I mean, the draft language doesn't allow you to be like a special event center. So like if you're renting it out, that's something separate.
The difference.
Yeah, but I think there's some things about the Woodland Realm that, some of the activities that would be more of a farm. The other two would be like, do you want to have unlimited sales? Do you want to be able to, as soon as there's, produce, put it out, and exceed that 16-day a week, or 16 days in a calendar year cap. So those would be the big ticket items. Right.
I mean, Woodland Realm is pretty unique from an event space, but there could be lots of people who want to do more in terms of sales, like almost community supported agriculture type of operation that technically under our code today, that's not allowed. Like you can't necessarily buy food that your neighbor grows on an ongoing basis.
But that's true of the urban garden too, though, right?
You can only
But
have
just
60
limited
days.
to the number of
Urban
hours.
garden, urban farm allows you to sell.
Yeah, so
But urban garden does not.
that's correct. So keep
16 days.
yes.
But under urban garden, it says only crops grown on the site may be sold on site.
Right.
For up to 16 days.
That's another, and Chris, I'm glad you pointed that out. That's another difference too. The urban garden, the sales are limited to stuff grown on the site, where the urban farm, that language isn't in there. So if somebody's making jelly or jam and they want to sell it as when they have sales at the farm, they're able to do that, or if it's grown off-site. So again, that's just another way of thinking about the farm being a little more intense of a use than the garden.
But they're both days or?
No, it's just the garden.
So the farm can sell whenever?
Yes, that's correct.
Okay.
That's
All right. I thought that's outread, but
So it's a home occupation.
That's kind of a way to look at it, but it's not, as the code structured, it's not a home occupation.
Thanks.
Yeah, and the ag stuff, a lot of changes, very aggressive. So I know that's kind of no pun intended, but it's the meat and potatoes of my presentation.
But the urban farm is only in non-residential.
I'm sorry.
Urban farms are in non-residential,
Or
unless it's a conditional.
That's correct. Yes. So the other two items are important, but not as kind of intense to think about. And that's, the second one is adding, excuse me, whoops, I had it. All right. It's adding a use category in the zoning code to identify data centers specifically. As I'd mentioned at the beginning, data centers, right, currently are either classified as warehousing, or we've found how to allow a small data center, which is really what's pushing this, is that there's a change in the industry where we're starting to see small ones that are intermix in more commercial settings. So we, not too long ago, had in the downtown data center wanted to go in a space within a building, and that was allowed through the conditional use process as a utility. So it's not a great fit as the best we could do to find a way to permit it in the zoning code, and so we really need to change the zoning code to reflect where the market's going. So yes.
Just a question. So does that include, like, for instance, like Google Fiber has, they have to have like a small shelter where they feed everything into, and then it feeds out. But is that part of the utility, or is that part of the data center use? Or how are we going to categorize something like that?
Yeah, I think that's more of a utility. This is more of a housing of equipment, computers.
So we're not changing that. That'll
No.
still be a utility by right and pretty much go wherever, correct?
Yeah.
Because it is a utility.
Right.
In the right of way, and those are hub telecommunication and internet.
Yeah,
hubs.
but they could find a big lot or something that they could, put that in it by right if it needed to go into a neighborhood to provide service for that.
Right. Yeah, and that's not what we're trying to catch with these.
No, but
change.
so this is different.
Yeah.
Than this is more of a
traditional,
kind of a larger. It is somewhat larger scale.
Yes.
Anything like that. Okay.
For sure.
Okay.
So we're establishing it as its own use in the code. Recognize the different scales, and two classifications, a major and a minor, and really that 10,000 square foot threshold is the difference. You can see also too the differences in the zoning districts that we're thinking about. So, these small ones make sense to allow in a floor in a building downtown, within a building on a commercial building on a highway corridor. So that's why you're seeing that we're proposing downtown and our heavy commercial districts for that, along with our industrial. And then the major data center, that's the traditional form of what we think of as a data center, very large warehouse buildings in industrial setting. And then last, the zoning code for a lot of uses that sell liquor, wine, and beer have separation requirements in the conditional use process. And that's all administered by the Zoning Board of Adjustment. Right now in the books, we require a restaurant to be 75 feet away from a park, school, church, daycare. In most of our zoning districts, there's a few there, such as downtown, where that doesn't apply. And what we've had some several cases before the board of restaurants wanting to go in by a park where it made a lot of sense, but the board wasn't able to grant it because it would have required a variance, which is a really hard test to meet. And so they asked us to go back and revisit this requirement. We really, in looking at it, believe that that the requirement's doing more harm than good, and so we're proposing to eliminate this. Just for restaurants.
So not a bar.
Correct. So it's got to be, was it 60% or more of food sales?
Than liquor.
Than liquor, yeah.
Are there any questions?
So there's some coffee shops that sell liquor too, or want to. How does that affect or the proximity to the house of worship?
Well, right now they'd be considered a restaurant. They'd need to be 75 feet away, like property line to property line. And so if we get rid of that requirement, then they could be side by side.
Okay, so I was contacted about, let's see, on Douglas, about at 30th, near near Water World. They wanted to have a coffee shop that was, apparently there's a house of worship.
Okay.
Well, maybe
I believe, were they just recently on the Board of Adjustment
Yes.
agenda? Yeah.
And so what was the outcome of it?
I believe it was denied because they didn't meet the separation requirement. The board,
But would they, under this new,
if they meet the sales thresholds of a restaurant, so they're, again, it's 60% more food, which might be more challenging in a coffee shop, then they would be allowed to be considered a coffee shop.
all right, well, I'll take that offline.
Okay, sounds great.
Any other questions?
Can you make sure that you detail a little bit how we enforce the 60%? It's always, it's always an issue, and people always push it.
Yeah, I can reach out to Eric Lundy and his staff to kind of work together on a coordinated response. I do intend to email all of you here shortly with the whole package of amendments.
Okay.
I just wanted to focus on these key ones this morning.
I think we've run into some issues on how you control the people.
Yeah.
On the,
And like, it'd be great. I'm going back to the data center one, and probably this is more for you, Scott. Every time they've been placed around the metro and other large cities have gotten, which has been a lifeline for them financially, we haven't. I always hear that franchise fee levels, especially when ours was at 7%, has a lot to do with our inability to secure them. Can we get some kind of review from your economic development staff and team about, in our is our efforts to attract them just, is it not going to work, or is that not a legitimate complaint? Do we hear that?
A large area of land requirements as well, but absolutely, and where the decision points are. But you're right, electricity is one of their large, if not the largest
expense.
line item.
And water.
But isn't it, part of it is certified site?
No.
Okay.
No, it's a relatively new, it helps.
Okay.
It helps, but that's a relatively new product.
Okay.
My experience in Council Bluffs and West Des Moines,
Yep.
it was about the land and it was
Electricity costs.
which is why Mid-Am garnered so many of those. Probably every one of the opportunities data is in Mid-America service area with plus here.
But a lot of
that's actually not where that industry's at. I mean, if you look at what has happened, Alliant has significantly higher energy costs than Mid-American, and they're now getting data centers at Cedar Rapids. The Cedar Rapids area has announced a couple, even though their electricity rate is significantly higher than Mid-Americans. At this point, it's about land, as well as a number of the data centers are looking to get their own energy. So if you look, Microsoft has a number of West Des Moines. It's been expanding in West Des Moines, but Microsoft just signed a deal that in Pennsylvania or New York, they're bringing a 3 Mile Island reactor back on, and so they want to be close to the energy, and they're paying a premium to do that, to get the clean energy, and they're paying a premium. So it's with the growth that you're seeing in the industry, it's access to clean energy that is, I think, the biggest driver.
We'll bring Mid-American Energy into that conversation. If you think we have a lot of data centers today, it's nothing, like a very, very small portion, maybe even 1% of what they're going to need because of the AI requirements that they're looking at over the next 20 years. So that's why the more data centers is also then going to trigger the need for more power generation.
Right.
And so we'll bring Mid-American Energy into that conversation and provide some more.
Okay. I think we will end this discussion, our work session, and then we'll reconvene at 4:40 for our regular council meeting.